All right, I'm coming closer.
Well, ladies and gentlemen, this is kind of a hodgepodge panel we put together, not intentionally. We wanted to talk about healthcare. Everyone's curious about tourism. It's been touched on already this morning. And Perdue Farms, the big giant that we have here on the shore, we can't leave them out. The agriculture and poultry industry certainly has had an interesting go of it the last year. So we're going to hear today from, to my right, Dr. Stephen Leonard, President and CEO of TidalHealth. To his right, G. Andrew Getty, Assistant General Counsel for Perdue Farms. And at the end, Susan Jones, the Executive Director of the Ocean City, Maryland Hotel-Motel-Restaurant Association. And they're going to talk about, among many things, opportunities and challenges. Steve?
All right, good morning. It's great to see everyone, honestly, in person. So again, my name is Steve Leonard, President and CEO of TidalHealth. So thank you all. The last time I actually spoke in front of this group was 2019, and who would have thought, quite honestly, about the last year. So a little bit about TidalHealth. I will tell you, we look different than we did back in 2019. So 2020 was obviously an unprecedented year. For healthcare, it was unprecedented as well. We went through a couple of mergers. Peninsula Regional Health System brought on Nanticoke as well as McCready into the system, and we became TidalHealth. I always tell folks that McCready and Nanticoke were looking for partners in 2019, and we brought them on, obviously, but it was just as important for Peninsula to have partners and to grow in scale, you might say. Healthcare is harder and harder these days, even without a pandemic, and to have the benefit of some scale is important. There's a map of the area that we serve at this point in time. There's two hospitals that are kind of the cornerstones of it, and I'll talk a little bit about medical partners as well. We have about 5,000 team members, about 250 employed providers at this point. When we came on and we came together, we said, it's time to actually create something different. We wanted to make sure we were not Peninsula General Hospital Medical Center. Some names you could never get away from, PGH. So we went through a pretty significant branding exercise internally. We took time with our team to talk about who do we want to be, who are we, what kind of connections do we want to create with the community. We had a little bit of fun, and I noticed videos being played, so Chris and I said, we'll share one of our internal videos with you. Now, this is an internal video. Some of you will not appreciate some aspects of this video, but some of you will probably get a good chuckle out of it, but it was really meant to talk with the team, kind of about what we're trying to create and a certain energy level, you might say. Again, not for public consumption, but we figured why not, we'll share a video while we're here. Go ahead, Steve, thank you. That was actually how we unveiled the name to our leadership team at Shorebird Stadium. It's another Tony Wake production, by the way. I think he's a theme here today, but we had a lot of fun with that. We would have used it in the public, but AC/DC wanted too much money for the song. So it was well beyond our not-for-profit budget in that regard, but we did have a lot of fun with it. And again, I think it was important. We all came together as a system to create something new. And really from a values perspective, hopefully reflect who we are in Delmarva, quite honestly. We always said we're not a Hopkins, we're not a university. We have a lot of really smart people, don't get me wrong, who are highly trained, but we're neighbors taking care of neighbors, family taking care of family, and that's what it means to be TidalHealth. So thanks to Chris and his team for putting that together. Our service area, I think, is actually represented nicely by our previous speakers. About 500,000 people in the service area, not including everyone who comes to visit us in the summertime, and they love to do crazy things while they're here. So we do get pretty busy when everybody else gets kind of busy. We have 4 legs of our stool these days that I commonly talk about. The 2 hospitals, medical partners, and ventures, so I'll kind of go through these quick. There it is, Peninsula Regional. We are a tertiary care trauma center for the state of Maryland, going back almost 50 years of doing complex cases and surgeries like open hearts. We are one of Maryland's designated trauma centers. So we do fly some stuff over to shock trauma. We're fortunate in this state to have shock trauma, but to a large extent, we are the entity on Delmarva. You pretty much have to go to Christiana or down to Norfolk or over to Maryland or Baltimore to find the complexity that you'll find in Salisbury at this point in time. Nanticoke and McCready brought wonderful water views to the system in addition to some great culture. So Nanticoke joined the system January 1st. They're about a 100-bed community hospital. They do a lot of great bread and butter type stuff, orthopedics, cancer. They do some cardiac work up there. Nanticoke had about 14 partners to choose from. Obviously, we were pleased that we were in the final running with Christiana. It was us up against Christiana. We were pleased they chose us. Largely, I think, because of that culture. We're very similar from a culture. We serve the same community. We already had an existing referral relationship. And our intent with Nanticoke is, quite frankly, to grow them. We're going to be growing them. We're going to be adding surgeons to the portfolio there. We've got a lot of exciting things. We're starting thoracic oncology there with Dr. Kurt Wayberg. We have some minimally invasive surgeons coming there in the summertime as well. So our strategy, much like all the growth we've heard about in Sussex County, is to grow volume in Sussex County. We actually don't want the volume coming down to Salisbury. We want Nanticoke doing as much as they can in this equation. There's another picture with the new sign. Medical Partners is the entity you'll never hear about outside of this room or in a talk like this. What you hear is TidalHealth Pulmonary, TidalHealth Cardiothoracic Surgery, TidalHealth Primary Care. It's actually all of our employed providers. Nanticoke had employed providers. Peninsula Regional had employed providers. It's more and more common for doctors to work as a part of health systems. I always tell people, if you think it's hard being a hospital, try being a small town country doc. It is really hard out there in healthcare, so it's more and more common for providers to be part of health systems. We actually have about 260 providers at this point in time. It's actually 23 different specialties that are part of TidalHealth Medical Partners. I expect that number to be about 300 within about 2 years. That's just reflective of the industry. What is also nice about something like that is you have the ability now to have an integrated experience throughout the region. So all those push pins that you saw, we go live on Epic July 1st with all of the Nanticoke locations. So in the 23 different specialties in the 2 hospitals, you can have one experience from an electronic healthcare record, you can have one experience from a TidalHealth perspective, and really coordinated and integrated care throughout the system, which is something we are pretty proud of. It's a listing of all of the specialties. Pretty much, if you need it, it's on there at this point in time. So much more and more is about ambulatory campuses these days. We have a goal to connect people with primary care providers. That's one of our goals, so people can live healthy and well and hopefully avoid the hospital, and much more of that is actually trying to get ambulatory providers closer to people's homes. So that's what you hear more of these days with growth with TidalHealth, is the different things we're doing out in the community in the areas where there's basically underserved folks or folks who have need. There's a picture of the McCready Pavilion, and as was mentioned, we're going to be looking at augmenting Somerset County. We have the Mears campus up in Seaford. TidalHealth Ocean Pines was our first larger campus outside of Salisbury. That started probably 7 or 8 years ago, and the last building is finally under construction. But the whole point about the campus approach is everything someone needs short of a hospital bed. So hopefully it's got every specialty, primary care, some diagnostics, some lab, but basically you can go to one campus. If you need a hospital bed, hopefully we can avoid that, but if you need that, Seaford or Salisbury is the plan, but those campuses should be quite nice. That building, I think, is going to open up with orthopedics. Pencil Orthopedics is coming to Ocean Pines in the fall, and then we're going to be filling it out with additional specialties right in Ocean Pines. Up in Sussex County, we've heard so much about today. Obviously, a lot of growth there. We've had a presence up in Sussex County. Most folks probably don't realize this, but out of about the $500 million of revenue for Peninsula Regional, prior to the merger, 24% of our revenue came already from Sussex County. So we were already somewhat Delaware. Now that Nanticoke is there, it's actually about a 40% Delaware, 60% Maryland split between the revenue. So we truly are a border system. We cover both areas, and we're obviously even looking to grow. The Millsboro Pavilion is a single building on 113. I guess I can show this. This is a picture of the campus. It's only been showed to the Millsboro Town Council at this point, but this is the campus that we have under development in just north of Millsboro off of 113. So much like the Ocean Pines campus, the intent here, that's about 150,000 square feet in those buildings, is again everything people need short of a hospital bed right on 113 just north of Millsboro. So we're pretty excited about that. We should be moving dirt in probably about 3 to 4 months on the first building, which is 100,000 square feet right in the middle. But as at this point, we're planning ambulatory surgery, rehab there, as well as additional commercial development with, I'll call them peripheral healthcare services. So we're looking at other things related to healthcare. We might not do it, but we want to have somewhat of a healthcare park up there where people can, again, our goal is to have people be healthy and well. And we're excited about the Millsboro North campus. A couple things I always like to mention. We are in the lab business. So we actually, we have probably 20 to 25 lab locations. Most people don't know that, but we actually compete against people like Quest and LabCorp. If you work for them or have family who work for them, please take no offense. My goal is to put them out of business on Delmarva. You talk about buying local. We do all of our analytics and all of our stuff here local. All of that stuff is shipped over water somewhere else to be analyzed. So we do take it seriously. And believe it or not, we make a little bit of money off a lab. And if I told you there was stuff we didn't make money off of, would you be surprised? Probably not. So we are pretty competitive with our lab business. Another business we're in is actually the home scripts business. I'm not trying to put Walgreens out of business. Really, it's for people who are discharged from the healthcare system or our team members, but we do have a pharmacy business because medication adherence is so important to be healthy and well, because a lot of people who are discharged from the hospital don't take their medications appropriately. We have some people who take medications when they're discharged. Believe it or not, I've seen people with 20 medications when they're discharged, 25, 30, and actually the most I've seen is like 35 medications one person's on. So the difference with our pharmacy is we're actually trying to get you off of your medications, unlike Walgreens. So our pharmacists actually will talk and try to actually, or Amazon or anyone else, we want to remove medications from people and get them healthy and well so they don't need it. So that is a little bit of a difference there. Health ventures are other businesses that we either own part of or all of. So we have a number of other companies that we work with. Let me see here. We have some surgery centers, home care, nursing homes. We'll probably be more in that business. Uridoxin we have a partnership with Uridoxin. It's an urgent care business. Why are we doing that? We do, prior to COVID, about 90,000 ER visits in Salisbury. About a third of them probably could be seen in a doctor's office. About a third could be seen in an urgent care location. So again, we want to get people to their right locations. So we partner with Dr. Ginelli on one of their locations, and maybe more in the future. But Health Ventures is that wing where I anticipate more and more growth from a health system perspective. It allows us to diversify a little bit and engage the community perhaps a little bit differently than we had in the past. COVID response, it's usually everybody wants to hear a little bit about COVID. I'm happy to tell you, right now we have 8 patients in Salisbury who are COVID positive. Haven't had a COVID admission in 3 days. That's the longest we have gone without having an admission, and haven't lost someone in about 3 weeks. So, good stuff. I will tell you, it's not over. I see I'm going to get on my, I'm not a preacher, but I'm going to get on my preacher stand a little bit. I see a lot of people without masks on right here, so hopefully you've been vaccinated. If you feel comfortable enough, please get vaccinated. The evidence is overwhelming about the strength of vaccination, and it is the thing. Ultimately, I do believe you'll either get COVID at some point, if you may have already had it and didn't know it, quite honestly, but or vaccination will help you. So please get vaccinated. My 16-year-old son got vaccinated. My 18-year-old daughter got vaccinated. And I anticipate Pfizer will be eligible for those 12 and over, probably within a month or two. It's being reviewed by the FDA right now. So even though the numbers are down, please take advantage of vaccination. I will get off my soapbox now. All right, so COVID-wise, the team was remarkable. Quite honestly, people like Chris and I were just privileged to be cheerleaders for a team, and this is really all hospitals, whether it's us, BB, AGH, Bay Health. You know, everyone really did a phenomenal job in taking care of the community, and we were proud to be a part of it and to watch them and to support them in their effort. They truly were on the front lines. We did some really wild things in Salisbury. We took our conference center, much like this, believe it or not, and we made it into a 44-bed, sorry, the slides need to go backwards. We made it into a 44-bed ICU. Actually, the state granted us, it gave us a couple $1 million, and at one point in time, we had 16 ventilated patients in it, just as an ICU. So some pretty, and that actually happened with the help of contractors in 3 weeks. We knew the wave was coming back last year this time, and it was pretty remarkable what ultimately happened. Now we're trying to figure out how to get it back into a conference center. It's more complicated going the other way. We had tents. I think everybody had tents because the numbers were just through the roof. But again, our team, and it was really all of our team, environmental folks, they were on the front lines just as much as any doctor and nurse, food and nutrition, security, you name it. We couldn't have gotten it done without the entire team effort. The community support, I will tell you, was overwhelming. Much of us gained 19 pounds with all the food that was donated, but it really was the team at the facility and throughout all of our locations did feel the thanks from the community. It was palpable, it was real, and I can tell you it absolutely made a difference when things just did not feel like they were going well. You know, when you have, especially we were, you know, very sensitive to newer team members. You know, they might have come right out of training, and what's their first year of training? Probably more death than they've seen probably some people in 10 years. So, but the community support really did go a long way. So thank you to many, if not all of you in this room, because whether it be the Chamber of Commerce, local businesses, restaurants, you name it, so many people came to the table, and our team is grateful for that. There's some more pictures there. So strategic direction-wise, like I said, tenet number one, our goal is to connect everyone with a primary care doctor. We want to keep people healthy and well and out of the hospital. We want to have people live healthy lives. How do you do that? You have a primary care provider. You need to see them on a regular basis. You need to have that partner through life. So if you haven't, that's my other thing, if you haven't seen your primary care doctor, please see one. Our number two goal, quite frankly, is that if someone needs something done from a specialized perspective or an acute care service, we want to be the system of choice. We want to be that partner that people don't think about just when there's a global pandemic. We were really popular last year, if you think about it. Everybody wanted to talk to us. You know, we would say something, Chris would post something on media, and people would listen. But we want to be that partner, not just when there's a pandemic, but really in life. And whether it's keep people healthy and well, or if somebody needs a procedure done, we want to be that place. A couple areas of focus I mentioned about the brand. Let's see, medical partners, electronic graduate medical education. This one's pretty exciting for us. We actually just had our site visit for our first medical residency program. So TidalHealth is institutionally accredited for graduate medical education. These are physicians going for residency training, which was always we have a lot of medical students, but we've always missed the residency piece. So we actually are in the process of getting accredited for our internal medicine resident. So we will have residents starting in the summer of 23. After that, summer of 22, internal medicine residents. Summer of 23, general surgery residents will start. And again, this is all about training kids local. And then hopefully they might go away to medical school, but maybe we can get them back here for a residency. They might go away for fellowship, but again, hopefully we can get them back here after that. So we want to provide that educational experience. We already have a great relationship with the local universities like SU, UMES, Warwick, Deltech, for quite a variety of training, and this is going to allow us to fill that last hole for interprofessional, all aspects of medical education. So we are excited about that. So at this point, I'm going to close out. We'll probably have time for questions afterwards. But again, thank you to each and every one of you for the support you've provided to us. And we look forward to continuing to provide that support in non-pandemic times as we collectively move forward.
Thanks. It's always good to follow the CEO, just generally. So, no slideshow, keeping it kind of low tech. You're probably looking at me asking, why is Perdue's Assistant General Counsel here talking to us today? Last March, I was tasked with running the company's COVID-19 response. So it's a pandemic. We don't have any kind of playbook. So we quickly assembled a team of the executive group, operations group, HR, our wellness centers to figure out how are we going to respond to this unprecedented event? What are we going to do to keep operating and get through this? So as you all know, Perdue, you think of chicken. We also have pork and beef and lamb. We also have one of the biggest agricultural commodity companies in the country in Perdue Agribusiness. So we're about 20,000 employees strong in about 15 states. Every state had a different response. Every state had a different approach to what they wanted to do and how they wanted to respond to it. So one of the things I was tasked with was making sure we were in communication with all the state representatives, all the healthcare representatives to make sure that we were doing what we needed to do to keep operating. I have to kind of start out and say thank you to all of the Perdue associates. We were a federally designated operation that had to keep the lights on, had to keep going to keep America fed. That brought with it its own challenges. Trying to find masks for 20,000 people when for 3 weeks they've been saying don't buy masks. You got to do that, and you got to do that quickly. So we did that. We opened up temperature screenings at all of our facilities. We increased pay to cover folks coming in to work, and we did some pretty neat things with dividers on the fly to set up as many barriers, as many protections as we could for our associates. On the Eastern Shore, which is what we're talking about here, CDC toured the 4 facilities we have in Delaware, Maryland, and Virginia, came through, looked at what we were doing, said, you guys are doing it right, keep doing it, and we were off to the races. So it's been a challenging year, to say the least. Dealing with the people, dealing with the operations, we also had to deal with the change in what people wanted to eat and how they were eating it. When you shut down most of the restaurants in the country, your retail business understandably takes a hit. You've got a lot of product. You've got birds that are waiting to be processed. You have to quickly pivot and do what you can to get food where it needs to be, which in this case was the grocery stores. So we were able to work with regulators you can't just take chicken that's meant for restaurants and get it into retail easily. So we were able to work with USDA to make that switch. We simplified our mix, which means not producing maybe as many products as you typically see on grocery store shelves, limiting the offering, but being able to get it out to folks that needed it. We also took advantage of what was new to us, online sales. So that our restaurant business come back, and that demand is helpful. Moving forward, I think we're all going to see some challenges. Again, this is the attorney giving economic advice, so take it with a grain of salt. But we're going to still see some disruptions to supply chain, and it's not going to always be the things that you think about. It may be the unavailability of cardboard for a certain amount of time, or different feedstocks that need to go out. So we're slowly getting there, but we're not out of the woods yet. And if I can borrow Steve's soapbox for a while, vaccines. Vaccines are what I've talked about pretty much every day since November. Anybody that will listen to me, I'm telling them to get their vaccine, get it soon. Make sure your family members get it. We're now finally to a point, thankfully, where we've done away with the phasing, with the rollout of which group can get it when. Largely, we're to the point where if you want it, you can get it. But navigating that phase was difficult, was challenging. Again, I'll send a thanks to all of our healthcare providers, the relationships we had with local and community and state health organizations to get our folks vaccinated when they were able to under the various tiers. Thanks to Steve and TidalHealth for making that available to our folks locally. But just to kind of preach on vaccines a little bit, and Steve can pick up when we get to the Q&A, but that's, in my view, how we get out of this thing. The economy is going to start to recover when folks are vaccinated and we can go back to normal. One of the lessons learned for us in talking to our associates about vaccines and what it means is, look, this isn't us as your employer saying you need to get vaccinated. This is being able to go to church, being able to go to family gatherings, being able to go to Little League baseball games like we did before this all hit. And the more we can drive home that message to folks, the better we can be. It's going to take a group effort. It sounds cliche, but the more we can get the message out to folks, not just from the employers, not just from the healthcare providers, but churches, community groups, the more we can get in front of folks with the medical people and tell folks how important it is to get vaccinated and have vaccine available so that people can get it when they need it, that's going to be how we get out of this. We still got a lot of work to do there, and I think that's kind of any analysis of what the economy is going to look like here in the next couple months, next year, next 18 months, really depends on folks getting vaccinated so we can move past COVID. Look, we're all fatigued. I've been, since March sitting in my basement doing Zoom calls with executives to try and get through the pandemic. We're all COVID fatigued, but this is really where we need to get kind of over the finish line, so to speak, here in the waning days. So a lot going on at Perdue in terms of addressing COVID, getting our folks back to work, getting folks healthy and vaccinated. And I'll get off my soapbox now, and hopefully we can pick that up in the Q&A. Thank you.
Well, I don't like standing between you and lunch. It's not a good spot, Bill Chambers. Thank you very much. But Steve, I'm happy to tell you, I was born at PGH. I had my children at PRMC, and I got vaccinated at the Perdue Clinic at TidalHealth because my husband is in the chicken business. So, it's all about chickens and tourism here in the Delmarva Peninsula, and if Danny is still here from Somerset County, I really loved his slide that said, we enjoy life. And I think that we are so fortunate to live on the Eastern Shore and to be able to work on the Eastern Shore and enjoy this life. And we have certainly been blessed to be able to live here. And I'm here to bring you the fun part before lunch. So it's all about fun for me. Although I'm going to tell you, hold on, backwards. How do I go backwards? 2020 was not fun. Raise your hand if you think 2020 was fun. Nope, wasn't fun. This time last year, I had 7 hotel members that were open. We had a very short window before we had Memorial Day weekend, and I had 400 members calling me saying, what am I supposed to do? I need to be open for Memorial Day. I need to be able to have a season. How am I going to do that? We had no guidelines coming out from the state, so we had to kind of develop our own guidelines and then sort of push them up the ladder to the state and ask for permission. For us, it also meant J1 students, who are those international exchange students that come from all over the world to work in our city, about 4,000 of them every summer. We didn't have J1s last year. We had 100 of them. So that meant our housing, the seasonal housing that historically is for J1s, entered our daily rental market and our weekly rental market. And that made the competition for rates just crazy. So rates plummeted. That meant it was very easy to get a room in Ocean City for $49. So if you can come to Ocean City for $49, you have a lot of stimulus money in your pocket, but there's nothing open. What do? You went to the boardwalk. And we had last June, which I am not going to even go over. So what that meant for Ocean City was a lot of pivoting. And Melanie, I would agree with you. I hate the word pivot. I am so over the word. But we really did, as an industry, have to figure out the new ways of doing business. We developed a Work and Play at the Beach campaign. We deciphered all of the available funding for our members. But hospitality was definitely the hardest hit industry. Perseverance in Ocean City rules, and we created this Ocean City We Are Strong. The lady who owns Fishtails, Donna Harmon, created that slogan and that flag, and we all rallied around it. And to keep up with everything, to survive the summer of 2020, we created a program that was called Hospitality Heroes. So every week, we featured a hospitality member who went above and beyond to serve the guest, to do something a little extra. And we featured them in the Dispatch newspaper because he donated space every week. So we had to bring that morale up for our people last summer. Now, if you read my bio, which I don't know if you guys actually read bios, but I have always built our association. I'm not going to say mine because it's not mine, but I've been doing it for 26 years, so it feels like it's my little baby. But I've built it around 3 C's: connecting, communicating, and collaborating. And I really think that COVID has taught us all to be better communicators and better collaborators. You know, someone mentioned that Bill Chambers had these weekly calls. Well, we have still continued those calls. We have another one next week. And that is so important through life. And I think that we all can reevaluate the way we can connect and communicate better as a society. So the way that we collaborated was we pulled in all of the different organizations. So in Ocean City, there's lots of tourism entities and partners. We have the Greater Ocean City Chamber of Commerce, Worcester County Tourism and Economic Development. We have the Ocean City Development Corporation. There's the Town of Ocean City Tourism and Marketing Office. There's the Art League of Ocean City, but we all have one common goal, and that is to figure out how to put business in our community so that we can actually have economic growth. And one of the ways we did that was we brought partners back together, all of these different groups, and we looked at it and we said, what can we do to get through COVID? How can we make sure that we still have a season? So we developed this Ocean City United and Strong messaging. Part of that messaging was pack your patience. So we had to tell the consumer, hey, we're happy you're coming here, but you better pack your patience because there's going to be long lines, there's going to be not enough staff to wait on people, so pack your patience. We had that last summer, and I'm going to have to pull it out again. Right, Melanie? We've got to pull it out because it's not going to be an easy summer. One of the other things we did through collaboration, we saw that we were, having another issue with the J1s. Are we going to get enough of these J1 students to come and work for the season, this season? And, January hits, February hits, embassies are closed, visas aren't being issued. So we collaborated with the Maryland Center for Hospitality Training. And what I reached out to a guy named Mike Haney, who owns that particular company, and I said, Mike, I've known you for 25 years. We've been on the Maryland Tourism Coalition together. What can we do to put Marylanders back to work in jobs in Maryland? Let's keep those jobs right in our community. So we developed a pilot program called Connecting Marylanders with Maryland Jobs. And basically what we're doing right now at this moment, we have students from all over the state of Maryland who are in hospitality programs who have been in his training classes to learn all about the American Hotel and Lodging Association and all of the certificates that are available through that program. And we've partnered to bring them to Ocean City to jobs that are in our hotels and restaurants, but the stipulation was the housing. So we had to collaborate on how do we get these people here because the barrier for some people is housing. So in order to participate in the pilot program, we had the employers provide the housing. So this summer, we're going to have about 100 students here from all across the state who will be living in the hotels and working in the hotels and restaurants. And I'm super excited. We welcome our first group of kids, hopefully next Friday, if not the following Monday. And part of what I've done for the last year is that bottom one, advocate. We have to realize that nobody's going to advocate for us. We have to be the ones to stand up and say, hey guys, this is the missing link, or I really believe that we could be doing this. If we don't share our opinions, they're not going to be shared. So we have to advocate. And I want to commend Delegate Hartman and Senator Carrozza because they're, my two peeps, and you guys have been awesome through all of this. And so I see Delegate Adams and Delegate Eckhart. I mean, you guys are amazing. Thank you so much for helping us advocate. This little slide is super important because we feel the way out of this recession that we've had is all about travel, because we have to understand the trickle-down of travel. It's going to start with you, the traveler. You're going to hop on a plane, you're going to hop on a train, you're going to go on a cruise line, you're going to get a rental car, you're going to stay in a hotel, you're going to eat in a restaurant. Well, all of those tax revenues are going to trickle down to your local economy. And I'm pretty sure Melanie shared the slides, but the amount of tax revenue that is generated by people traveling is astounding. So I am here to tell you that next week is National Travel and Tourism Week, which is a program that the U.S. Travel Association shares across the entire country. And I want you guys to make sure that you travel soon. And if you haven't been vaccinated, go do it, right? And then you can travel. But the trickle-down numbers are just amazing. So the power of travel really works. Industry projections. So I mentioned U.S. Travel, and they are a group that we have followed throughout all of this because they pull together all of the partners. They have the American Hotel and Lodging Association, the National Restaurant Association, any large body that deals with anything in travel, all falls under this U.S. Travel Association umbrella. So throughout this entire year, they have been advocating to Congress, and they have been working to get the Restaurant Revitalization Fund, to get all of these funds that are helping the PPPs. So we've been working with them very closely to follow what's going on. You've heard it all morning. We have people who have remained employed. Those people have saved a lot of money. Those people are ready to really go shopping. They are ready to travel. And we want to make sure that we capture it as the Eastern Shore. They can go get vaccinated right away. And I'm also happy to say that next Tuesday and Wednesday in the Convention Center, we have a hospitality vaccination day. We haven't emailed that out yet, have we, Lachelle, from the Chamber? I'm looking at Lachelle. It's going out tomorrow when we get back to our computers. But that is next week. So vaccines are available. What's not available is people to wait on you. So that is the tricky part. The labor shortage, and someone asked that question right on, early on, how do we get everyone back to work? That's a huge concern to us as well. So the pent-up travel and the demand is there. 9 in 10 people are going to travel in the next 6 months. Surveys are telling us that. But how do we find the people to wait on them in the restaurants, to clean their rooms? Well, what's happening is people are not finding them. They're offering $15 to $20 an hour right now in Ocean City, and we can't find people to do the work. So what's happening is we have hotels who are not opening up their entire inventory for rent. They might only be opening up 75% of their rooms. Restaurants are not operating 2 full shifts. They might just be operating 1. So what does that do? If you take a $200 room night at 11% room tax, let's do the math, you know, that's what, 22, help me do the math, guys. You're a lawyer, do the math. $22, $22 in room tax from one room. We have 10,000 rooms in Ocean City. So there's going to be a loss of tax revenue. So we have to figure out how to open up and how to get back to normal, because if not, we have a lot of tax revenues at stake. What it's also doing, it's making people find new ways to operate their business. So they, you know, in addition to having to pay higher wages, they are really having to innovate. And someone mentioned that earlier. This is a time for innovation. And I believe those who do innovate are going to be the ones that come out on top. This is a slide that just came out recently. These are the activities that travelers plan to do during the summer. And I want you to, it's kind of small if you can't read it in the back. Basically, we're going to dine at a restaurant. We're going to go to places where we can recreate on an ocean, lake, or river. We're going to shop. We're going to visit a national park, participate in outdoor activities, hike, bike, amusement parks, museums, breweries, wineries. We have all that on the Eastern Shore. We are so fortunate to live where we live and to have the fact that all these people are going to be coming. We have to prepare and get ready because they're coming. Now, Steve didn't talk about the fact that mental health has taken a crisis, right? I mean, that's a huge hot topic. So I want everybody sitting out here in this audience to find your fun. In the next few weeks and months, go fishing, take a jog, play on the water, hit some golf. I want you to find your fun. Are you going to find your fun, Steve? And there's a lot of fun to be had in Ocean City, I will guarantee it. We have a lot of new restaurants. Melanie put that list up. Lots of new restaurants, lots of new activities. So I want you guys to find your fun in the next coming weeks. Mr. Chambers, it's back to you, sir.
Quick time for one question. We're going to go right into wind update and lunch.
Hello everyone, thank you very much. My name is Leonard, CEO of SDTS Group, a digital health services company. Fantastic panel. I think there will be much more of a debate to discuss all of what you guys have up there, but I think we're trying to make room for lunch. I definitely wanted to say that we are pleased to be part of the Delmarva, Southern Delmarva community. We're actually at the Tyson's Corner. Everyone here has been very friendly, and we're new, so we're just excited to be here amongst you guys in our digital health solutions. But my panel to the question is that we worked on a lot of disease outbreaks around the world, and Ebola in particular was our software that was used for most of the contact tracing. And then I see after the Ebola was finished, the same economic challenges we're getting on how to get back on our feet, etc. So it's like we're going back to the whole thing again. But the challenge I'm seeing now is it's becoming a requirement for some employers to actually have their employees vaccinated before going back to work. But then the question also is that how are they verifying that? So my question to you on the panel is that are you making it a requirement for your employees, not necessarily your guests, to be vaccinated before coming back to work? And how are you verifying that they've been vaccinated besides a simple paper that we all know that they give that you can read on the day? Thank you.
We're going to go with the lawyer on that one.
So I don't know which microphone works. I'll
Here.
speak as loudly as I can. So Perdue as an employer does not mandate vaccines. It's voluntary. And in answer to your question of how do we track it, so depending on the state, depending on the location, we've been able to help facilitate vaccine either clinics or events at our site. It helps that we have wellness centers because we actually have nurses that can administer the vaccine after going through the accreditation process with the various states. So if we have an associate who was vaccinated through one of our events, we have that data. The challenge, as you alluded to, is for everybody else that may have gotten their appointment on their own, done something online, gone to Walgreens, we have to rely on them to bring us their vaccine card to share with us that they've been vaccinated if they're willing to do that, because we can't always in every instance require that they do that. So there are some challenges moving forward.
So we, at TidalHealth, we're not requiring it at this point in time. The FDA, these vaccines are approved under an emergency use authorization. So we feel we want to get a little bit more data for them to be fully approved. We highly encourage it, and I do foresee a time where it will be required once there is a full formal approval, much like we require a flu vaccine for people working in healthcare. You might as well now get into the thought process of a booster at some point in time to address variants. It will get approved formally beyond the EUA. I think I can see it being required as well once it gets to that point. Many schools, my daughter's 18, she'll be heading to SU, but she's gotten notifications from probably 6 or 7 schools that she's been accepted to that they're not requiring it yet, but they are highly encouraging it, and they are likely going to require it, so it's coming.